Pregnancy is a joyous moment in every couple's life, and I would be discussing 10 essential things you need to keep in mind when you're pregnant. Point number 1. Discuss with your doctor the testings for thyroid, vitamin D and blood sugars right in the beginning of pregnancy. These 3 hormones need to be balanced in the first 3 months because that is the time when the baby is being formed. Point number 2. Do not put on, and I repeat, do not put on more than 12 kilos of weight in the whole of pregnancy. Putting on excessive weight in pregnancy leads to higher chances of blood sugars and blood pressure in pregnancy. In fact, for some patients, if they're overweight already at the beginning of pregnancy, or if they have blood sugars in pregnancy, we even recommend that they should not put on maybe more than 3, 4 or 5 kilos in the entire amount of pregnancy. Point number 3. Pregnancy is a natural event. There is no need for you to restrict life and natural activities like walking, going out, sitting on the floor, going for a movie, or maybe even going for dinner. Unless, of course, your doctor has specifically told you not to engage in these activities for some time. Point number 4. Follow a healthy diet. Visit a nutritionist. They know exactly what to prescribe so that you have a healthy pregnancy. And remember, drink plenty of water right through your pregnancy. Point number 5. There are always these myths about exercising in pregnancy, and we're always very scared that exercise might cause problems in pregnancy. The actual point is that you must exercise in pregnancy. Swimming is really the safest. The American Pregnancy Association says that if you've been gymming and weightlifting before pregnancy, you can actually continue doing these things even in pregnancy. So if your doctor allows you to, you can actually do the treadmill, the cross trainers, and even some lightweight exercises in pregnancy. Point number 6. It's very essential that you undergo a screening for Down syndrome in pregnancy. What is Down syndrome? It is the most common cause of mental retardation in children. How is it done? It's done by doing an ultrasound scan between 11 and 13 weeks of pregnancy, done on the mother, and followed by a blood test done on the mother as well. It's extremely sensitive and can pick up almost 95% of the problems. Point number 7. If you get just one ultrasound done in the entire duration of pregnancy, it must be an anomaly scan. An anomaly scan is done between 18 and 20 weeks of pregnancy, and at this point in time the baby is fully formed and the sonologist takes a look at each and every part of the baby to understand and to document that the baby has formed absolutely fine and there are no abnormalities with the baby. Point number 8. Gestational diabetes is diabetes developing in pregnancy because of pregnancy. It usually develops around the 6th month of pregnancy, and if it goes undetected, can have serious deleterious effects on both the mother as well as the baby. Speak to your doctor about testing for gestational diabetes around the 6th month of pregnancy. Point number 9. As per the international guidelines, every pregnant mother should take the flu vaccine in pregnancy. The flu vaccine protects you against the influenza virus and the swine flu virus throughout your pregnancy. In fact, it also protects your baby in the first 6 months after it's born because no such virus vaccine is given in the first 6 months. And the vaccine is actually absolutely safe in pregnancy and can be taken from right at the beginning of pregnancy till the end of pregnancy. So do speak to your doctor about the flu vaccine as well. Last but not the least, after the 28th week of pregnancy, make sure you count your baby's movements every single day from the 28th week. Discuss with your doctor how to go about counting these baby movements and as well what you should be doing if the baby movements are lesser or more than the previous day's baby movement counts. That brings me to the end of the 10 essential things you must look into in pregnancy, and I wish you a very happy and a very safe pregnancy. The day the pregnancy card turns out to be positive, it's a very exciting day in any couple's life. It's a happy moment. There's a lot of planning about the entire 9 months and the coming of a baby and so on and so forth which happens. And then the symptoms of pregnancy sets in, and the most troublesome of them is nausea of pregnancy. Today we're going to discuss about 5 important facts that you should know about nausea in pregnancy. Point number 1, it's normal to have nausea in pregnancy. Everyone has them. It occurs with the rise of beta-HCG, or what is known as the pregnancy hormone. It's more in case of twins. So in twins, it means double of everything. It usually disappears by the 3rd month of pregnancy. But very honestly, I've had patients who had nausea and vomiting as well, right till absolutely the end of pregnancy. Sometimes we also find it very reassuring, because as long as the patient has nausea, it does mean that everything is going absolutely alright with that pregnancy. However, having said so, it does not mean that if you're not having nausea of pregnancy, there's something wrong with your pregnancy. This differs from person to person. So there would be people who would have extreme amount of nausea in the first 3 months, and there would be some women who would have absolutely no nausea, but yet their pregnancy is absolutely fine. So do not panic if you don't have nausea. But if you do have nausea, you need to bear with it with a brave heart. Point number 2. So what can you do to avoid this nausea of pregnancy, or at least reduce the nausea of pregnancy? The most important thing to do is not stay hungry. You will realize that you're not able to have big meals anymore. So divide your meals in small, frequent meals throughout the day, which are non-oily and non-spicy. Point number 3. Keep a dry toast or a cracker biscuit right by your bedside when you sleep at night. All through the night, because you stay hungry, you build up a lot of acid. So first thing in the morning, and before you get out of bed, have either the dry toast or the cracker biscuit before getting out of bed. That will help you neutralize the acid and thus reduce the nausea that you face very early in the morning. Point number 4. We all have grandmother's advices, and this is one advice that really works very well. Keep a small piece of ginger in your mouth at all times, and you'll be surprised as to how well this ginger helps you prevent the nausea of pregnancy. Lastly, point number 5, there are medicines like doxylamine succinate and ondansetron which can greatly help you with both the nausea of pregnancy and if you have vomiting as well. Honestly, they're FDA approved, very, very safe medication, so I see no reason why you should torture yourself so much and not take these medications, but of course take them with your doctor's advice. I wish you a very happy and safe journey through your pregnancy. Every single day in my practice, I encounter patients, their husbands, and their families raising concerns about doing frequent ultrasounds in pregnancy. I would like to reassure all of you by saying that ultrasound waves are nothing but sound waves, and they have absolutely no deleterious effect on the mother or the baby. In fact, the ultrasound has made the pregnancy far much more safer than what they used to be in the yesteryears. Today we are going to discuss the 5 essential ultrasound scans that you must get done in pregnancy. Scan number 1, the early pregnancy scan. This is done around the 6th or 7th week of pregnancy and has 3 very important functions. Question number 1, is the pregnancy growing inside the uterus where it's supposed to be growing? Question number 2, is the baby actually safe? Can we see the heartbeat of the baby? And question number 3, is the growth of the baby as measured by the ultrasound matching the growth of the baby as measured from the pregnant woman's last menstrual period? Ultrasound number 2, the first trimester screening. The first trimester screening is done between 11 and 13 weeks of pregnancy. This is done to detect Down syndrome in the baby. This Down syndrome is the most common cause of mental retardation in children. This ultrasound between the 11 and 13 weeks picks up Down syndrome by measuring the thickness at the nape of the neck, as well as the ultrasound is now so good that it can pick up some other abnormalities as well between the 11 and 13 weeks. And this test done between the 11 and 13 weeks is far much better than any other test done for Down syndrome, like the triple test and the quadruple test, which are of course done much later in pregnancy. Scan number 3, the Anomaly Scan. The anomaly scan is done usually between the 18 and 20 weeks of pregnancy. By this time, the baby is fully formed, and the sonologist would be doing the ultrasound to check each and every part of the baby to determine if all the parts have grown all right and that there are no abnormalities with the baby herewith. Scan number 4, the growth scan. This scan is done around the 30th week of pregnancy and has the potential in picking up any lag in growth or excessive growth of the baby if it's happening at that point in time. How does it help us? It helps us because we are able to pick up this lag or excessive growth almost 2 to 2.5 months before the actual delivery, giving us sufficient time to manage any complications happening because of these problems. The 5th essential scan is a tie between doing a fetal echocardiography at 22 weeks or a well-being scan done at 36 weeks of pregnancy. The fetal echocardiography is advised for mothers who are probably diabetic or have twins in trying to pick up any abnormalities in the baby's heart, which is best seen at 22 weeks by a specialized ultrasound. The well-being scan is done at about 36 weeks to pick up things like if the baby is upside down, if the water around the baby has gone down, or if there are multiple loops of cord around the neck, which helps us plan the way the woman should actually ultimately deliver. I know it's difficult and sometimes even scary in the way technology is changing things around us, but I can assure you that ultrasound is one friendly technology that can only make this pregnancy much more safer and better for us.